Okay, we're back with Dr. David Fox, a vascular surgeon in New York City. Dr. Fox, a little different approach today. We want to talk to you about your personal life, kind of how you got to where you are today in medicine. So I want to start out by asking you what inspired you to go into medicine?
I think probably the most significant thing were some of the experiences I had in childhood with family illnesses. I remember my grandmother she had a prolonged illness and spent a lot of time in the hospital, and so I was exposed to her care and the doctors taking care of her. And I remember my grandfather, he had his appendix out, and the surgeon came out in his scrubs, and it made quite an impression. I figured, well, that's pretty cool. I think I might like to do that. And also was fascinated by a lot of the technology that was being used to help people. Was very interested in how heart surgery was done, open heart surgery, and basically that was sort of the seed that sort of got things going.
Very good. Now, it's one thing to have the inspiration, and I'm sure there's lots of young folks that have had the inspiration to be a doctor, but tell us about the path to get there, how you took it through college and all to medical school.
Well, during college, I majored in biology, actually double majored biology and English. Graduated cum laude from Tufts University. While as an undergraduate, I worked spent some time in the laboratory of Dr. Hobson, who was the chief of surgery at Boston University, and he was a vascular surgeon. So I became involved in vascular surgery research, and also had the opportunity to see how he and his fellows took care of the patients, and just became fascinated with vascular problems.
So then through Tufts, and where did you go on to medical school?
Right. So I went to medical school at Boston University. I was elected to Alpha Omega Alpha. After Boston University, I did my general surgery residency at the University of Rochester, where I continued to develop my interest in vascular surgery, which is basically care of patients with problems of arteries and veins. And then I took a fellowship in vascular surgery at Loyola University in Chicago.
Very good. Now, I know before we had our meeting today, you've had some key accomplishments in the area of vascular surgery, and are known, in fact, for certain procedures. Can you elaborate a bit on what led you that direction and what exactly that is that you do?
Sure. Well, some of the areas of interest of mine are vein disease, care of patients with varicose veins. We've been utilizing some of the new techniques in the care of patients with varicose veins, including endovenous ablation, which has basically replaced the old techniques of ligation and stripping.
Very good. Now, as you work with patients, what's been some of the rewarding cases that you've done through the years?
Sure. I can think of a number of patients come to mind. I can think of one middle-aged guy, avid cyclist, and he would go on these 50-mile bike rides, and the varicose veins would bulge out, and he would just have terrible aching. And I took care of his veins. We actually treated both legs. And he was just the happiest guy in the world. He's able to get on his bike without having those throbbing, bulging veins. He was very happy. So another woman in her 40s who had put off, she had heard bad things about the old ligation and stripping, and she had put it off for a long time. We did an endovenous ablation to treat her varicose veins, and she said it was the best thing she had ever done in her life. So,
very good. Well, I guess that's part of your legacy, no pun intended. And so we appreciate that personal insight today, Dr. Fox, on your background.